De acuerdo, nos falta Rachel Stevenson, pero vendrá ahora mismo, así que si queréis podemos comenzar ya con las preguntas. Esperamos a Rachel.
Can I have a question? Can I speak in English? So
Yes.
I have a question actually for the parents, like, because it seems to me that Rett syndrome had a lot of symptoms, and then to treat different symptoms, maybe there isn't one treatment for all. Maybe for different symptoms, you wanted different kinds of treatment. For example, the motor deficits, the language deficit, the sleeping deficit, the breathing deficit, like, even for gene therapies, you might wanted to think about, which region of the brain you wanted to interfere. So I'm just wondering from the parents, like, what will be in a tiered way, what would be the most important one you wanted to repair first, and then the second, and go on? Because we already have a couple of potential remedies for treating different things, for example, muscle atrophies, motor deficits, maybe there's something, and for the immune system deficit potential, there may be something different. So I'm just wondering what your thoughts would be from you guys as well. Anybody who can understand me.
I think that's a very, very good question, and I wish I could give you a simple answer. I have surveyed families to get at that list. You're not the first researcher to ask. I think given the spectrum of the disorder, it depends what symptom affects that child the most. For some parents, it would say, please take away her seizures. If you could only take away her seizures, that's the one thing that would make our life better. If she could only keep her hands out of her mouth and you could quiet the hand stereotypy, so some of the motor impairment, that would make their lives better. If she could only have a GI tract that could make her chew, swallow, digest, and eliminate food, their lives would be better. So I could give you a list of all of those symptoms, and I'd like you to just fix all of them, if it's no small favor. But I think for me personally, what I've heard from so many parents is we don't mind being the arms and the legs of our children, but if we could hear them talk, if we could only know what they're thinking, and if they could tell us. So if we could break through in the area of cognition and mood, and understand that part of the brain and free them up to be able to better tell us what's on their mind, we would probably put that at the top of the list, but I'd hate to speak for all parents. Do you have something to add to that, Monica?
Yes. So for me personally, it depends what week you would ask me. So on a week where my daughter has really bad seizures, I would say seizures number one. On a week where she's incredibly constipated, I would say that. Lately, over the last couple of years, she's developed so many movement disorders, head bobs and hand tremors, and her hand that goes like this. So the movements have now taken over her life and mine. That would be at the top of my list, but it really depends. One thing I can say is I've heard clinicians, so there is a scale called the top 3 caregiver concerns. So, if you bring your child say you're in a clinical trial, that's one thing that they might ask you. When you go to a visit, they would ask the parent, what's your top 3 concerns? And they would compare that to before you started the trial, maybe week 1 of the trial, whatever, and after you're done, and see if there's been improvements. So one thing, for example, that clinicians have said to me is, it's weird, but the parents don't really say hand use or communication. I think it's because we've kind of gotten used to it. We're used to our kids not talking. And also I think we think that that's a really hard thing to fix. And so we're looking at more, we're applying some common sense and being reasonable about our requests, I would say. But of course communication. I think if I ask most of you, if your wish was granted and you could only have one symptom, what would it be? I suspect 99% of us would say communication, right? We'd want them to talk, because then we could figure everything else out. We would know what would hurt, you know, and so on and so forth. So, yeah, it's not an easy, I guess it's not an easy answer.
Yeah. In complement, I would just want to say that if you ask young parents with a young child, they want to cure all symptoms at once. They want to cure the disease. They want to hear it anymore. But if you ask older person, when they have a red woman of 30 years old age, they want improvements in breathing system, because they usually have chest infection and it can cause death. So this is also a problem of aging. We can't obviously have the right answer depending on who you're asking.
¿Alguna pregunta más? Vamos a Mar.
Gracias. Antes que nada quiero felicitarlos. Más que pregunta es comentarle lo que nosotros vivimos en México con Fer. A Fer le ponemos inmunoglobulina, se la ponen por medio de un catéter. Ya tiene como 4 o 5 años que se lo ponemos. ¿Qué nos ha ayudado mucho con ello? De que no le den, que le suba el sistema inmunológico y que no le den estos ataques de bronquitis agudas o principios de neumonía. Eso nos ha ayudado mucho y también le ayuda a bajar las convulsiones de cierta manera. No sé si ustedes lo aplican en alguna parte del mundo, ¿no? Y la otra es, tenemos un tratamiento de tetmodis, que la sustancia activa es tetrabacina. Esa la usan principalmente para mal de Parkinson y nos ha ayudado a bajar los movimientos muchísimo. Tetmodis y la sustancia activa es tetrabacina, ¿no? Entonces eso nos ha ayudado. Tetrabacina. Ahorita se los. Sí, tetmodis y la sustancia activa es tetrabacina. Así es. Así es, sí.
The compound is tetrabenazine. I think it's available in the United Kingdom. It's available in the U.S. through various ways. I think we buy it through Canada, actually. It's been used in Parkinsonism, but we've used it in one girl who had very bad movements. It had a positive effect on the movements for perhaps 6 months. And then it seemed to lose its efficacy, but then later on the movements have gone away. So, yes, it's a depleter. Depletes it.
Sí, también la inmunoglobulina le ha servido mucho. La que le ponen es Kiovig.
Yo conozco otras niñas que usan esto también.
Sí, entonces, bueno, esa es nuestra experiencia, la que hemos.
Do you have any patients on immunoglobulin therapy?
No, we have, I'm not aware of any on immunoglobulin therapy either. I know none of ours are, and none in the natural history study, as far as I know. We, in years past, looked very closely at immunoglobulins and found no deficits in those. Now, we do have one girl who has an immune deficiency, but that's related to another familial genetic disorder the family has.
Yeah, I know about four girls that are using it. And those were girls that were just sick all the time. And they've gotten better. But I don't think their Rett symptoms improved, but they're healthier.
Vamos a pasar el micro. Bueno, Beni por cercanía y Alfonso después, ¿vale?
Hola, Yo me gustaría saber si todos los trabajos en Estados Unidos y el resto de Europa se centran solamente en MEP2 o también se están estudiando los red lights.
So we're focused on MECP2. The natural history study sees CDKL5, FOXG1, what else? Duplication.
MECP2 mutations that are not Rett syndrome causing, and MECP2 duplication. So that data is being analyzed for the natural history of the progression of those diseases, but at rettsyndrome.org, we're purely focused on MECP2.
Okay,
Can
hi,
I just
Monica.
add that some of the treatments might be appropriate for people whose children don't have an MECP2 mutation. For example, in the Sarizitan clinical trial, it's not part of the inclusion criteria to have an MECP2 mutation. They do check for one when you enroll, but it's not part of the inclusion criteria.
Okay, so I have a question for Monica. You mentioned as part of your Enable branch that you were building an IPS biobank, could it be? So how available is that if I, just hypothesizing, if me myself as a researcher want to perform some experiments on IPS, could you actually get in touch, contact, and have any kind of access to them?
Yes, yes, but we're not ready yet.
Okay.
We're building them, and it's going to be patients that are in the outcome measure and biomarker development, so there'll be a lot of very deep phenotypic information. And yes, it'll be available to anybody once it's up and running.
And
so
do you have
maybe-
like an estimated due date? Like, you know,
No.
I mean, it's a matter of, I guess it's a matter of time. And
It's going to take a while.
Okay.
Yeah. So we have a few lines, but so why don't you at least get me your contact information,
Sure.
and then I
I'll
can
just-
keep you updated.
sure, thanks.
I would also add, though, that there is an institute in the U.S. called the Coriell Institute, and they do have availability of cell lines at this time.
Cell lines, but I don't
I-
think. A
Certain-
lot of them just didn't take, and they ended up.
Yeah.
Yeah. Sorry.
Mike.
Sorry.
Yo tengo una pregunta. Perdón, tengo una nena de 10 años que hace 2 meses empieza con movimientos en su cabeza constantemente. Y estoy muy preocupada porque me da miedo que sea progresivo y no los pueda parar y cada vez sean más severos, ¿no? Eso no lo tenía antes. Y quiero preguntar, en base a su experiencia, si se puede deber a cambios hormonales. Aún no le baja su menstruación, solo tiene 10 años, es un bebé. Pero escuché que una de las mamás que está en el foro dijo que también empieza con movimientos. A mí eso me preocupa mucho. No sé si se puedan parar o...
I think that's a question for Alan. So I think she said her daughter's 10 and she started to make some head movements. Yes, like this. And she's worried they're going to get worse, and is there something she could do now? I mean, well,
I do a lot of things, but I'm not a movement disorder expert. But if she can make a video of that and not forever, let's say a 1-minute video, and send it to me, and I will pass it to my movement disorder person, and he will give a.
Yeah. Movement disorders are very, very difficult to treat, I think. I can, if you find me later, I'll tell you the name of a couple of medications you could discuss with your doctor.
I'll tell you privately.
I just want to say that in terms of head movements, I can't really say, but my daughter, she used to have to put her hands in her mouth a lot, and now she's almost not doing it. And also she was never able to grab things, and now she can grab things both with her left arm and right arm. So things there's an evolution in things, but also in a positive ways.
Buenas, a mí me gustaría saber, hablaron del ensayo clínico de Neuro Pharmaceutical, pero lo han dicho muy a la ligera y me gustaría saber un poco más. Como están a punto de entrar en la fase 3, quisiera saber qué se persigue, qué objetivos se persiguen con ese ensayo.
So Alan Percy is one of the PIs for the trofinetide neuron clinical trial. We're trying to get him a headset or an earpiece so he can understand. I believe your question is what is our goal for trofinetide? So I can tell the company, their goal is that their compound affects the underlying biology of Rett syndrome. So for any given child who's taken the drug, so the first phase 2A of the patients who took trofinetide were adults. They were at low dose, and they took it for a very short period of time. But during that duration, they saw a variety of improvements. And it's not a drug that's going to treat breathing. It's not a drug that's going to treat seizures. It's going to treat the underlying biology so that we hope that we will see improvements that are unique to that child. The phase 2B trial was done in younger patients, a higher dose, and for longer duration. And we saw the improvements increase even more. So, Dr. Percy, if you'd like to talk about what the aims are for phase 3 for trofinetide. I don't think the protocol has been publicized yet, but phase 3 tends to be a larger population.
I wish I knew what the aims are for phase 3, because they haven't been discussed in general with any of us clinicians. But we expect to see those maybe in November of this year. But I anticipate that they will be looking at something called the Clinical Global Impression of Severity and Change, which is one that we have used in both of the previous trials, and they seem to have reasonably good outcome. They seem to be good outcome measures. One of the measures that we have used, called the motor behavioral assessment, didn't turn out to be meaningful. There is a checklist made in the United Kingdom about 1997-98 called the Rett Syndrome Behavioral Questionnaire, and that will be used. And then there is a caregiver outcome measure. But I'm talking off the top of my head. I'm not sure exactly what they'll be using.
¿Alguna pregunta más? ¿No? Bueno, pues con esto concluimos el día de hoy y mañana nos vemos a las 9:30. Gracias a todos por estar aquí.